My name is Anatoly Bolkin. I'm a vascular surgeon. Originally, I came to the United States about 30 years ago from the former Soviet Union to study medicine. Did my medical training at the University of Southern California, did my residency in Los Angeles, and went over to Houston to do my fellowship in vascular surgery, and then came to San Diego about 10 years ago to start a practice here.
My name is Stefan Moldovan. I'm a board-certified general surgeon. I perform general surgery procedures and vascular procedures. Dr. Balkin and I have joined forces in 2009 under the name of San Diego Vascular Center. In November of 2010, Dr. Sasha Saloom joined the practice.
I'm Alexander Sasha Saloom. I'm a vascular surgeon here at San Diego Vascular Center. I am also a interventional specialist as far as minimally invasive procedures.
The philosophy of San Diego Vascular Center is based on a deep and thorough understanding of the patient's medical condition and needs, followed by the application of the latest technologies through minimally invasive
So you may not know that you have a heart problem. Well, the simplest, easiest way for us to catch that is by doing peripheral arterial disease screening, and that's what we offer. Most people have had a blood pressure done of their arm, and it's very similar to that. We do a blood pressure test of both of the arms, both bicep areas, and then we do it along the entire length of both legs. And we compare the pressures on both. It's non-invasive, painless, and it's a simple, pretty quick test. And based on the numbers that we get, we see if there's a problem. We also actually interview the patient, ask them if they've had leg pain and whatnot, but the screening is a very simple procedure. Anyone that has a family history of heart disease, for instance, anybody who has leg pain or a history of atherosclerosis or high cholesterol, well, then we could address the problems. For instance, let's say you rule in for having an abnormal test, such as we have to be concerned about coronary artery disease or other things. Then we do the full workup. We check their cholesterol. We check the patients. We may have to get an EKG. We may have to go through the family history and see what else is going on. But one of the most important things is to check their vascular status and look at their blood work, such as cholesterol. And then we attack it at that and try to prevent any future occurrences of coronary artery disease or peripheral vascular disease. It's just a general screening for us to look for the overall health of the patient's vascular status. It's a very simple procedure. It's like getting your blood pressure checked.
Carotid artery disease. It's a blood vessel that supplies the circulation to the brain and is one of the leading causes of stroke for people. The idea behind doing a screening of the carotid artery is to try to screen and find the blockage in the carotid artery before a person has a stroke. But one of the main causes of stroke is the plaque in the blood vessel that supplies circulation to the brain. So when the plaque breaks off, the amount of blood that's going to that part of the brain decreases, and that part of the brain dies, and that's what a stroke is. If we can remove the plaque, or decrease the plaque, or fix the plaque, which is different ways that we treat carotid disease, then we can potentially decrease the probability that the person is going to have a stroke. The screening is, again, very simple. It's an ultrasound procedure. The screening is how we find that the person has the disease, because the person doesn't know that they have a problem until the symptoms occur. And the symptom is a stroke. So the screening is what allows us to see the carotid arteries. We take a picture of them with an ultrasound machine, and we can see the plaque. We can measure how much plaque a person has. We can measure how much blood flow is going to their brain, and we can see the degree or the percentage of narrowing in that blood vessel. There is no risks from screening, and if the disease is found, then obviously we recommend treatment depending on how severe the disease is. And that's the basis for our practice, is to be able to allow the person to enjoy their life to the best of their ability to do so. Everybody cannot have an ultrasound. It's physically impossible. So we have to try to select the patients who are more likely to have vascular disease. Patients who have carotid disease have other vascular disease. And if they have a history of heart problems or leg pains, we're more likely to screen them. Being older, smoking history, high cholesterol, all these factors negatively impact your health and are more likely to cause plaque buildup in your blood vessels. And those are the patients that we tend to screen most commonly to try to find the disease. And even if we fix the blockages tend to come back. And that's the idea of us promoting the healthy living concept, and the idea that if you can modify your lifestyle, and if you can modify your diet, and we have to give you the best medications that are available today to treat this life-threatening disease, we can get a better outcome. If you already have a problem, unfortunately, the only solution to it is we have to fix it. We either have to remove the plaque, we can do a bypass, meaning that we go around the plaque, or we can put a stent, like a spring, to hold the plaque open and to allow more blood to go to an organ. In this case, it's the brain. We also have to manage their medications and adjust them. And we do that in conjunction with our primary care physicians. There are specific guidelines that we encourage the patients to follow. These guidelines have to do with them exercising, and the walking program an hour a day is what we recommend. The guidelines include specific changes in their diet. For example, we know that salt increases your risk of plaque formation. So we tell them to eliminate all salt intake. And even if you do that, you'll still have too much salt in your food because everybody that you buy in the supermarket today has some salt. Cholesterol is a big issue. We know the amount of cholesterol that you're getting, or you can find it out by looking at what you're buying in the supermarket, and having a conscious effort in doing so will help your overall health.
I'm Ralph Chapman. I was at Sears with my wife, and then I guess a couple aneurysms, my muscles, my legs, so I couldn't even walk. So the paramedics brought me to the hospital, and Dr. Balkin operated on me and put, I think, 7 stents in. It's been great till this year, and then one of the arteries burst. And Dr. Salome, well, he saved my life because I don't remember leaving the house, the paramedics taking me to the hospital, anything. I woke up in intensive care, and everything was done. It wasn't long. I was out of the hospital. I was right back to doing everything I always did. My wife works at the church, and I do all the handyman stuff around there. They've been great with me. And I've been, since the emergency surgery, I've seen Dr. Salome, and he fixed the other side so that won't happen again. So I can't say enough. I'm still going.
Stands for abdominal aortic aneurysm. It's a life-threatening problem. And unfortunately, a person does not know that they have an abdominal aortic aneurysm. There's no symptoms associated with the problem. It's a ballooning of your blood vessel. It can happen in your chest or in your abdomen. It can happen in your legs, in your arms. There are definitely risk factors. A lot of it is genetic. So people who have a family history with their father or mother or grandmother, siblings, having an abdominal aortic aneurysm have a higher chance of having an abdominal aortic aneurysm. People who have a history of smoking definitely have an increased risk for developing an abdominal aortic aneurysm. And age is a big factor. Being a male also makes you much more likely, 4 times more likely, to have an abdominal aortic aneurysm. The abdominal aortic aneurysm refers specifically to the ballooning of the aorta in the abdomen, and that's the most common site for the aneurysm to form. When the symptoms occur, meaning that bubble bursts, the risk for a person to die is astronomically high. And unfortunately, most of those people don't make it to the hospital. The idea that we have tried to promote here at the San Diego Vascular Center is to be able to screen a person to see if they have an abdominal aortic aneurysm. Since there's no symptoms, the only way you can pick it up is by doing an ultrasound. The ultrasound takes a picture of your stomach. And if the aneurysm is seen on the ultrasound, then you can fix the aneurysm before it ruptures. There's probably 2 million people in the United States who have abdominal aortic aneurysm. And it's the 13th leading cause of death in the United States. The reason the prevalence of the disease is so high and the incidence of death is so high is because, again, the person doesn't know that they have it. So unless you have the ability to pick it up early by a screening program, we as a medical society don't have a better way of addressing the problem. Today, our ability to treat the aneurysm is amazingly good. And therefore, it makes all the sense in the world to try to find these patients who have a life-threatening problem earlier.